Hey, look at all these cylinders. Let's learn how to change them out. Now, at your hospital, you may have a bulk provider like Airgas or Lindy who changes these for you, but it's a good thing to know how to do them yourselves for a couple reasons. One, it can be a difficult process in that there are lots of potentials for leaks when you change out cylinders, and you may just want the added control of having responsibility of that process yourself. The other reason it's a good idea to know how to do this is in case you have an issue with your supplier or you have an emergency and they just can't get there in time, you need to know how to change these out. So we're going to walk through what it takes to change out an H cylinder safely. So you've received a secondary supply and use alarm on your master alarm panel. It's time to change cylinders. We're only going to need 2 tools for this job, an adjustable wrench and some leak fluid. So the first thing we're going to do is close the valves on the cylinders on the empty or depleted side and then remove them and replace them with new. To turn these cylinders off, just going to close the valves clockwise until it's fully seated. Once that valve is closed, use your wrench and loosen the pigtail end by turning it left or counterclockwise. You're going to do this slowly, and the first thing you're going to listen for is that hiss. That tells you the pressure in the pigtail up to this check valve is relieving. If you don't hear the hiss, continue to turn very slowly until you hear it, because until you hear that, this line is still pressurized. So if you move too quickly, you'll get a surprise when the pressure loosens and relieves all at once. So we want a gradual pressure release, and as soon as that hiss stops, you know the pressure in this pigtail is empty, and you'll feel the looseness here, and then you can just remove it by hand. Keep in mind when you remove these that anytime you have a pressurized system with a check valve, that check valves can fail. As you release this end of the pigtail, if you still have pressure and it's not decreasing, you may have a problem with the check valve up here at the header, in which case you're going to have to close that side of the manifold and service it. So just make sure the pressure is gone in this pigtail before you release it fully. Once that's removed, this is closed, we're ready to transport. The very first thing we're going to do is put a cylinder cap on it. It's like wearing a helmet when you ride a bike. You do not want to move cylinders without this cap in place, because if it falls over without the cap and the valve breaks, it's going to turn this thing into a rocket, which you don't want anywhere, much less in a manifold room. Okay, once our cap is in place, we can remove the chains. And we're ready to move our cylinders. 2 methods for moving cylinders. You can use what's called the rock and roll method. Just rock it back onto the corner of the bottom and then roll it like that. A little bit of technique to this, but with a little bit of practice, it gets easy. If you're moving at longer distances, especially between rooms in the hospital, if you're leaving the manifold room, you really want to use a cart. You have single and double cylinder carts. You should use these anytime you're transporting within the hospital. Just make sure once it's on the cart, you secure it with a strap or chain before you leave the manifold room. So within the room, you can move them by hand. Outside the room, make sure the cap is on and it's secured to a cart. Okay, so we've removed our empty cylinders and we've got some full ones here. A quick note on cylinder identification. You should have a system in your facility for how you identify full and empty cylinders. It may be a tag like this that's reversible, so this one's full, and we just flip it over when we're going to put the empties in a separate location in the manifold room. Or you may have the paper hang tags that show full and empty, and you just rip off the bottom once it's empty. However you do it is up to you. Just make sure you have a way to identify between full and empty cylinders in your manifold room. So this is our full cylinder. We're going to go ahead and put this into place before we remove this cylinder cap. We have our caps still on. We're gonna reinstall our chains. Remove all our cylinder caps, and we're ready to reconnect. So just a couple quick things before we reconnect this pigtail and finish up our cylinder change out. It's a good idea when you install a new cylinder to just crack the valve. That's all it takes. Just so if there's any debris inside this valve, it'll blow it out into the room before we connect our pigtail. We don't want any debris getting into the manifold. So quick little open, close again. That's all that takes. And then a note on pigtails. These are CGA, Compressed Gas Association, gas-specific valves. So every pigtail is specific to the gas it's intended for use with. Carbon dioxide is CGA 320. So just realize that every time you replace pigtails or replace cylinders, these are only going to connect to the type of gas that they're intended for use with, and you should never try to modify a pigtail to get it to work. Same process in reverse. Attach your pigtail, make sure your threads are lined up correctly. You can tighten that on by hand and then finish it wrench tight. Should be wrench tight, but doesn't need to be excessively tight. As soon as these are all replaced and the pigtails have been tightened on, we're going to very slowly open this valve. And you'll hear the pressure initiate as soon as you get this valve open, and you'll see the pigtail kind of stiffen up a little bit as the pressure enters that pigtail. And then once it's pressurized, you can open it fully. So you've responded to your secondary in use alarm, you've replaced all of the cylinders, everything's back open and pressurized. At that point, your alarm should be clear, because the manifold now recognizes it has pressure again on the backup side. Very last step before you walk away from this is to leak test. This needs to be done every time you change bottles. So we're just going to spray leak test solution on the connections we just made. Make sure there are no bubbles. If there are no bubbles, you're good to go. So we've replaced our empty cylinders, put full ones in, opened everything up. We've leak tested, our alarms are clear, everything's good. All is well in the realm of gas.